Here we can see the torn ACL at the tibial surface, which is being trimmed, and the fat pad which is in the anterior aspect is also trimmed. Now we can see the medial meniscus. We are checking the intactness. We have checked and it is intact. Now we are preparing the femoral footprint with the help of a radiofrequency ablator. This is the medial surface of the. Now we can see the radial tear of the medial meniscus, which is chronic in nature. Now we are repairing it with the help of a suture passer fiber wire. Initially, a bite is taken at the anterior fragment and then the posterior fragment. It is very skilled work what we are doing here. Taking bite at either end of the torn meniscus and approximating it with the help of knots. Yes, now both the fragments which are torn are held together. Now a sliding knot is being put and the repair is secured, which you can see now. This is one of the difficult tears in meniscal injuries. Yes, now you can see the knot sitting nicely over the torn meniscus, which is very firm. And here, after the meniscal repair, we are moving on to the femoral tunnel preparation for the ACL reconstruction. This is the bead pin drilling and again the suitable reamer which we have chosen depending on the size of the ACL graft. Normally for the dual synthetic graft, we'll be using a 6 mm drill bit. Now we are preparing the tibial surface for the drilling. That is a suture shuttling, which is used to pull the synthetic dual graft. And now we are done with the tibial tunnel preparation as well. Yes, now a beautiful dual synthetic artificial graft is being pulled towards the femoral tunnel from the tibial tunnel, and again it is cinched at the lateral aspect of the femur. Nicely sitting synthetic dual graft. See, it's very stable, taut and beautiful. The reconstruction is beautiful. The synthetic graft is being placed at its anatomical footprints. Thank you.